intrusive memories, flashbacks, nightmares, avoidance of certain stimuli, physical distress upon exposure to certain stimuli. These are all symptoms of PTSD, post-traumatic stress disorder, which in the DSM is listed as a trauma or stress-related disorder. The other thing to know about PTSD, though, is it's a form of an anxiety disorder. So if you think about all of those symptoms, distressing dreams, intrusive memories, all of those things relate to an aroused or hyperactive or hypervigilant central nervous system, which is what anxiety is. Anxiety is driven by fear. So it's very important that if you're in treatment for PTSD, the trauma-based or the exposure-based treatment for trauma is the best thing going in terms of overcoming those traumatic experiences and the impact on the person. But what I want to argue is that if you are in treatment for PTSD and you're doing a prolonged exposure-based treatment like EMDR or another form of exposure-based therapy, it's also important that you ask your therapist to help you with coping skills for anxiety. Because when you're feeling stressed or anxious or fearful, it's going to make your symptoms of PTSD worse. So it's important that you learn to regulate your nervous system through things like self-care, and that includes exercise, it includes that endorphin release, it includes nutrition and hydration, getting adequate sleep. All of those things are important. Also learning coping skills for when you start to feel anxiety welling up inside you. And then strategies that you can use throughout the day when you're not feeling anxious so that you can better regulate your nervous system and be less likely to experience anxiety. So if you're in treatment for PTSD, make sure you're also getting help with those anxiety symptoms and regulating your overall level of anxiety. If I can help you, shoot me a message.